How to make your scars disappear after surgery or an accident. I'm Dr. Barrett. I'm a plastic surgeon here in Beverly Hills, and I do a ton of surgeries where we try to minimize scars as much as possible. Number one, it first starts with the operation and minimizing your actual trauma to the skin, your meticulous closure. This is going to depend on your surgeon, all right? And then comes the steps afterwards, which you can control. All right, step number two is to minimize the mobilization of the area. So I recommend taping the immediate post-surgical environment for where the incision is. So if it's like on a shoulder, we don't want to move the shoulder very much. If it's on a breast, we want to tape the breast, wear a supportive bra, so you don't get little micro movements in your scar and in your incision that cause the cells to have to put out a bunch of scar tissue or put out a bunch of glue to kind of hold it together, okay? Once you immobilize for at least 2 weeks, then you want to do some type of scar management therapy, okay? What we like to do is a combination of a scar gel. The product I recommend is called Skinuva. It's because it has silicone in it and it has growth factors in it that are present in a fetal wound environment. Fetal wound environments, there's no scarring, okay? So you put that on your incision twice a day, so that massage and the scar gel will actually help a lot with the scar maturation. What we wanna do is suppress the collagen production, okay? That's what we're trying to do. And that primarily gets done topically, okay, with the scar gel and then also silicone tape. Silicone tape exerts a competing force pressure on it. What that means is it tricks your fibroblasts into thinking that it's butting up against another cell. It's called cellular inhibition, okay, contact inhibition. So if your neighbor grows right up to your next to your property, it's like, all right, I've gone far enough, I don't need to grow any further, right? So silicone kind of recreates that contact inhibition environment. So silicone cream, silicone tape on the area twice a day, and in contact as much as possible for at least 6 weeks, ideally 6 months. And then you also want to control your total body inflammation, okay? If your total body inflammation is upregulated, you know, you're going to increase the total scar output from your fibroblasts, okay? So 2 products I recommend are fish oil and masszymes, okay? Digestive enzymes are known to decrease inflammation in your body and help rearrange wound healing environments and help you heal. Fish oil helps reduce that production of scar tissue by lowering the inflammation in your body. Now, a lot of these things can be done preoperatively. Make sure that you're going into surgery with low inflammation in your body with the fish oil and digestive enzymes prior to your surgery. The other suggestion I have is red light therapy. Patients of mine who have used red light and in studies have shown a greater decrease in their scar appearance faster, and they heal much faster when they use red light at least 20 minutes a day on the incision, okay? So this is a product I recommend. It's called LightStim. It's available, all these products are available on my website, postoprecovery.com. Check it out. Let me know if you have any questions.